chain up to the dorsal part of the leg. You start with the beginning of the plantar fascia, you go up there, try to stretch it and to make it a little bit smoother than before. You go up over the Achilles tendon, up to the gastrocnemius muscle and to the fibula, and then we go to the hamstrings and treat all the parts where the tendons have their offspring and the part where the tendon goes over through the muscle up to the highest point here. We start normally at the most painful part of the plantar fascia. It's the beginning with the ground joints here. We go up there. You can feel a lot of points here that are normally like hardened muscles. At this time it's in the fascia. If you have such a point, you go through it like this and try to stretch the whole plantar fascia. And always talk to your patient about the pain. You also can use this very, very important point in the middle to show on the other side exactly where the tibialis posterior tendon comes in here. It's often very painful and you have to release this point. Another point is here at the middle foot where the peroneus tendon comes in and has its insertion here. Very painful point. Then you go through the whole edge of the foot and you can release the joints in the middle foot. And then you can, if you have smoother muscles and fascia, you can do any chiropractic at the small joints. You can even do that this part like this, stretching, and then you will feel that you ease the joints and the plantar fascia. The treatment, we use another applicator to get it specifically on the parts that we have to go through in more detail, like the basic joint here. You can perfectly work on every part through the whole joint and relax it. You can also go on all the other basic joints if you want. And then we go into the parts that I mentioned before. Here, insertion of the tendon and a very important part of the middle foot. So, treat it even in more detail. And the same on the joint here. And you can do this from every direction, but always talk to your patient about the pain. And work on the whole joint. Because then you have all the most important trigger points here. And you can also go on very painful points and very hard points of the plantar fascia, wherever they are. It depends on the patient. And you can go up to the calcaneus and treat the smaller painful points here too. Achilles tendon, you start with the insertion points. You stay on each point for a few seconds just to ask if the pain is decreasing. If the pain is decreasing, you go up the points in the middle portion of the Achilles tendon. Do it on all sides. You go to the point where the tendon goes over to the muscle, and then you go to the typical gastrocnemius points where you normally have the trigger points or the hardenings. You can do this on the medial part of the gastrocnemius up to the point where it goes over the knee. The same on the gastrocnemius on this side. About 3 very important points, and the last one goes up to the knee. But you also have to work on the soleus muscle and the peroneus muscle. They're coming to the insertion at the fibula here, very, very important point here. You have to smooth them. And if you work on a trigger point, you really have to use some pressure. You can do it with this applicator or with the bigger one, but you really have to use it with pressure to stay on the point until the pain is better, and then you go up. Always have it on pressure to feel it better. On the Achilles tendon, you start at the insertion parts where the tendon comes in, and you stay on the points until the pain decreases. You always have to talk to the patient. Then you go up to the middle portion of the Achilles tendon. Do it from every side. Wait for the decrease of the pain, and go up to the muscle, over the trigger points. Stay on the trigger point if you want. If this is the most painful part, you go through, and then you go up the whole way of the gastrocnemius muscle, up to the insertion point over the knee. Very, very important, because you need the stretching of the muscle. You do the same on the lateral part. You can feel it. Work on the trigger points and go up over the knee. And then also work up to the fibula, where you have the soleus muscle. Work here until you feel the smoothing of the muscle. And then go back to the Achilles tendon and try to increase the pressure and ask the patient if it's better now. You start at the knee points where the muscle can have the first hardening. You go up the points at the semimembranosus and tendinosus, all the hamstring muscle parts. Like this. You treat points from the beginning, over the middle of the muscle, up to the insertion of the hamstrings here. And you can go through all the muscle and feel all the points that are too hard and smooth them, and talk to your patient about the pain. The same is the lateral part. You start at the knee, go over the tendons, up the biceps, and to the insertion. We show the longer 50mm applicator going into the tissue to the insertion. You find the insertion at this point. Then you can give some pressure on it wherever you need it, or change the ankle, put some pressure on it, hold it, go back. Do this from every side to the insertion until the pain goes away.